Welcome to today's press briefing on COVID-19. On stage, we have Dr. Lippi Lee, Undersecretary for Health, Dr. Zhang Shouquan, Head of Communicable Disease Branch of Center for Health Protection, as well as Dr. Gladys Guan, Chief Manager, Medical Grade from HA. Dr. Lee. Good afternoon, friends from the media and fellow citizens. Welcome to the press briefing. Dr. Zhang will kick off with an update of the COVID situation in Hong Kong, and I'll give the floor to Dr. Guan on the situation with our healthcare system and also individual cases. And then I will brief you on changes in our infection control measures and also amendments to CAP 599L. Dr. Zhang, over to you. I will give you an update of the latest situation of COVID-19 in the past week. Now, we had a slight increase in the past week in the daily number of cases. In the past 7 days, the average was 5,568, which was a slight increase of 5.4% over 5,281 daily cases in the previous week. For local cases, we have an increase of 5% from 4,768 to 561. Imported cases, we have seen a greater increase of 10.6%. In the past 7 days, the average is 403 per day, whereas for the previous 7 days, we had 364 daily. Imported cases accounted for about 7.2% of all positive cases in the past 7 days. Over half of the cases were picked up at the airport on day one, and then cases found in the subsequent 7 days, about 44%, and they account for 4.8 to 5.2% of all the arriving passengers. Death cases are rather stable. We have about 52 fatal cases reported a week, and that is about 4 to 10 cases per day, compared with 5 to 12 days per day in the previous 7 days. So it's roughly the same. And for subvariants, BA.5 is still the dominant strain, is about 88%, and we have a small percentage of BA.4 and other sublineage. Now, for imported cases, XXB accounted for the majority of the cases. We have about 182, BA.2.75, 0.26, BQ 1.116, BA.465, and BA.711, and 6 cases of XBD. We sample randomly local cases. We have BA.271.2 and BQ 1.1 and XBD cases. In residential care homes, for the elderly and the disabled, we have a number of cases. However, the trend is stable. We had 31 compared with 30 in the previous week. So the situation is more or less stable. For schools, the daily average is 3,500 odd cases against 3,500 as well in the previous week, and 90 schools have to have class suspension. Whereas for the global situation, during the week of the 17th to the 23rd of October, we've seen a slight decrease of 15% and a similar drop of 13% in the number of deaths. Globally, BA.5 remains predominant. Of course, we've noted the appearance of other sublineage, BA.1 and also XBD. They can be found in some places in Europe. The number of cases is still rising, although the pace has somehow slowed down. BA.4 or 5 still account for the majority of the cases, with minority cases being BA.2, 0.75, and BA.4-5 still dominant in the UK. There is also BA.2.75 and 4.6. Now, this may not be very clear here, but then BA.4 or 5 still account for the majority, but BA.6, 11%, BQ1 and BF7, some cases identified. In New Zealand, in the Southern Hemisphere, BA.5 is still predominant. There are still a BA 2.75 and also a BA6 and XBD, and then BQ is also found in Singapore. XBB accounts for over half of the cases in Singapore, 54%. BA5 is lower, stands at 21%. Now, there is not a substantial increase in the number of hospitalizations and deaths, and we have not seen serious cases of XBD. In summary, in the past week, we have seen an increase in the number of imported cases, in particular with a slight increase in the number of locally acquired cases. And in other countries, new sublineages are appearing, such as BA.1.1 and XBD. Now in Hong Kong, we have more XBD among imported cases. So we expect to see XBB cases in local cases, and we start to detect other subvariants among local cases. That ends my briefing. Thank you, Dr. Guan. Thank you. In the past week, the situation has seen some ups and downs. The number of hospitalization has risen to 1,800 to 1,150. The daily average is 230 newly confirmed cases admitted to hospitals. In the past week, the number of critical and also serious cases still remained at 60 to 70 cases. We have more non-urgent operations being performed. Over 90% of them resume, and endoscopic procedures have resumed normal, and over 80% of the non-urgent services have now resumed. We mentioned a 31-month-old boy who was infected with COVID. His situation deteriorated, and he is still in critical condition in the ICU of QEH. We will try to provide appropriate treatment to the baby as far as possible. And we've got a 21-month-old baby girl. On the 22nd of October, due to fever, high fever, and shortness of breath and loss of appetite, she was admitted and confirmed infected with COVID, and her situation stabilized, and she was discharged. And yesterday, she started to have wheezing, and also situation deteriorated. She was in critical condition. After providing treatment, she was transferred to ICU. Now she requires ventilator for breathing. However, her situation has become stable. The baby girl has got 2 doses of vaccine. In her respiratory sample, the COVID is found, and then another type of virus was also detected, and she's given appropriate treatment. We'd like to appeal to parents, please get your children vaccinated if they're yet to be vaccinated. Only 10% of the children below 3 years old have got 2 doses of vaccine, and this is not desirable. Unvaccinated children have a high risk of infection. Once they are infected, they can become serious, and there is a possibility of meningitis and also croup. In serious cases, death can result, and there can also be medium and long-term after effect. The weather is now cooler. In addition to COVID, we expect to have the seasonal flu, and please arrange for your children to be vaccinated against seasonal flu to avoid your children being infected with COVID and seasonal flu at the same time. So do make arrangement for your children to be vaccinated to enhance protection for your children. And I'll pass the floor to Dr. Lee.
As for anti-epidemic measures, our basic principles have remained unchanged. That is science-based targeted efforts and we try to offer proper management of risk and also citizen-focused facilitation. As for the priority of our measures, we will first relax those measures to ensure that there is a lower risk of rebound and also that our healthcare system will not be under strain, and will also strike a balance between infection risk and economy. We also make sure that there is consistency in our measures. We hope that in our road to resumption to normalcy, we won't keep retracting our measures, and that the general public can resume to normal lives as soon as possible. As you've heard from Dr. Lee and Dr. Chuan and Dr. Kwan, there have been sporadic subvariant cases, especially XBB cases. We also see serious cases among young children, so we should not be complacent. Given the COVID situation after the implementation of 0+3 arrangement, our number of confirmed cases has gone up from 300 to about 400. And new cases see an increase of about 5.4%. The number of death cases and serious cases is rather stable. It seems like our healthcare system can afford the number of patients they receive, and the number of hospital admissions is rather stable as well. We hope that life will resume normalcy soon. From the 3rd to the 16th of November, we will relax the following social distancing measures. First, barbecue places under the government will be reopened. The relevant departments will, starting from next Thursday, that is the 3rd of November, will gradually reopen these facilities. Secondly, we will lift the 599 scheduled premises operation hours. Thirdly, for eating premises and sports facilities and religious premises, as well as hotels and conference rooms and guest houses, as well as multi-purpose rooms, when people take photos on stage, they can be exempted from wearing masks. That means people attending wedding banquets, they can take off their masks when they take photos. The further relaxation of social distancing measures is resulted from your cooperation. So hopefully you will continue to wash your hands frequently and wear face masks and get vaccinated soon. If you feel unwell, please get tested soon. And if you're confirmed COVID positive, you should consult a doctor soon and follow the doctor's instruction to take medication. Please work hard together. Hopefully, we will be able to resume to normalcy gradually. This is regarding social distancing measures. Now I will talk about prevention and control of disease vaccine pass regulation. The High Court on the 21st of October has given a ruling. It is mentioned that in 599F, it does not empower the government to invalidate the vaccination exemption certificates. 2 days ago, the government had decided not to lodge an appeal regarding the ruling, and we will directly amend the relevant legislations. After consulting legal advisors, we have made the following decisions. We think that there is an urgency to fight the pandemic, and considering the time needed to lodge an appeal, we think that amending the legislation is in Hong Kong people's interest. So 2 days ago, we have made the Gazetto regarding prevention and control of disease vaccine pass amendment regulation 2022. Yesterday, we have submitted the relevant information and amendment to LegCo through negative vetting, and it has been passed by the LegCo. And the content of the amendment is mainly to empower the Secretary for Health to invalidate exemption certificates if it is found that or there is reasonable suspicion that the doctors in question did not conduct proper consultations before issuing the exemption certificates. It also empowers the Secretary for Health to declare that certain exemption certificates is invalid. And doctors in question who objects to that can submit written representations to the Secretary for Health. So if the Secretary for Health does exercise the power, the relevant consideration is whether there are loopholes in the vaccine pass scheme and there's also consideration that whether the doctors concerned have conducted proper consultation before issuing exemption certificates, and the number of certificates issued within a certain period of time and the mode or pattern of issuing the certificates. Of course, we'll also consult the Department of Health for their advice, and it has been declared that the exemption certificates issued by the 7 doctors in question are invalid, and they will no longer comply with the requirements of the vaccine pass scheme requirements. And these 7 doctors concerned have the right to submit written representations to explain why the certificates issued by them should not be declared invalid. We strongly advise holders of these invalid exemption certificates to receive clinical assessment to see if you are actually not suitable for getting vaccinated. You may go to outpatient clinics for the assessment, and you can also consult your family doctors. For those who are suitable to get vaccinated, please do not wait anymore, so that you will not be exposed to the risk of getting infected. This is all for my briefing. We'll now take questions. Before you ask questions, please identify your media outlet and please keep yourself to 2 questions. Any questions? Yes, the lady on the right. I'm from Economic Times. Regarding exemption certificates, you've now declared the exemption certificates invalid. Are you making a judgment before even scrutinizing the exemption certificates? Do you have reasonable grounds to suspect that all exemption certificates issued by the doctors were invalid in the sense that they had not conducted proper consultation? Regarding the 21-month-old baby girl, why was she discharged? What was her condition when she was discharged from the hospital? And did she undergo any tests regarding her nasal problem? And also, how do you comment on the effectiveness of the vaccination and regarding this case? Also, why do you decide to relax the social distancing measures for photo taking?
Perhaps I should give the floor to Dr. Kwan to talk about the situation of the baby girl first. With regard to the 21-month baby girl, she hasn't got any underlying disease. After admission, she received treatment and her situation stabilized, and on the 26th, she was discharged. Well, when she was discharged, her condition was stable and no particular examination was done to check whether she had that rhinovirus. That virus alone can also cause croup. And we are seeing what is the most appropriate treatment for that baby. She has had 2 doses of vaccine and her situation is relatively stable. Now, after treatment, we believe her prognosis is quite good. All right, I will comment on why we have a reasonable suspicion that if a proper clinical assessment hasn't been done, then we can invalidate exemption certificates. As we all know, some doctors had issued dozens of exemption certificates per day. It is hard to understand how come within such a short period of time so many exemption certificates could be issued even without a thorough clinical examination. Furthermore, some of the doctors were not in Hong Kong, but then because the cases are sub judice, it is not convenient for me to comment further. Now for Cap 55L, according to the court, the regulation hasn't authorized the government to invalidate exemption certificates. However, if there is such a power in the regulation, it would be more reasonable for the government to invalidate exemption certificates. So we believe it is reasonable for us to amend the regulation to allow the government to do so. And why do we allow photo taking on stage with mask off? We have mentioned a basket of considerations. Now, members of the public would like to see barbecue sites reopened, and then the catering industry would also like to remove the restrictions on their business hours, and we've received suggestions from the public, particular those holding wedding banquets, that if they have to remain mask on for so long, they are asking whether exemption can be granted. And we believe the risks are controllable now, and so we have proposed this relaxation. And for other infection measures, anti-infection measures, hopefully we can gradually remove them. Hopefully, we will not see a rebound of COVID infection cases so that we will be in a position to relax further. This is not really passing a judgment before a trial, because if you look at Cap 55, the secretary has the power to do so. So it is not really passing a judgment even before the trial. Any more questions? Good afternoon. I'm Orange News. On relaxation of anti-infection measures, the government have priorities. What are the measures that should remain until the last minute? And for vaccine pass and compulsory testing notices. Now, I'd like to know the percentage of positive cases picked up by CTN. How useful is it as a tool? And as for the vaccine pass, is there any room for it to be adjusted? Now, some legislators are of the view that tourists with amber codes should be allowed to go to theme parks and to eat out. Do you think there is the possibility of narrowing down the restrictions under vaccine pass? Now we have new subvariants found in Hong Kong. Will that have an impact on our epidemic situation? If the answer is no, can we change the quarantine requirement to 0+0? Now, is it really normal for the virus to continue to mutate? If that's the case, does that mean that the epidemic can never end? Well, there are quite a number of questions. Priorities. What are the measures that will be relaxed in the very last? Now, when and what and how the epidemic measures should be relaxed is the outcome of discussion by the whole government team. And I think remaining mask on should be something we hold on to. In particular, the seasonal flu surge is around the corner. Now, if we remove the mask on requirement, I think the rebound will be quite likely. So I think we will have to continue to wear our masks for a while. As regards compulsory testing, we do monitor our quarantine requirements with our eye on the development of the epidemic. Now, we rarely have restriction testing orders now, and then for compulsory testing, we can indeed, let me put it this way, compulsory testing can allow us to pick up silent transmission chains, in particular, where there are buildings with not too many positive cases. And if according to our sewage surveillance program, the viral load is rather high or abnormal, we have reasons to believe that there are silent transmission chains. It is a way to help government to identify confirmed cases as soon as possible so that they can be given appropriate treatment and to control the epidemic. The vaccine pass, well, this is a proven policy and is a major strategy in controlling the epidemic. Given that the situation is still unstable and we have just observed a rising trend, I believe the vaccine pass policy will have to stay for a while, at least until we are more assured with the epidemic situation, and then we can consider relaxing it or removing it. As regards the 0+0 quarantine arrangement, we have just been given a briefing by Dr. Zheng on the number of cases. Now, the number of imported cases have seen a 10% increase. That is quite serious, given the background. And if we relax the quarantine requirement to 0+0, the risk will be high and is against our policy to control risk to a controllable level. We may think that we do not have too many serious cases, but we should be prudent. On our road to normalcy, I hope we will not have to backtrack and reintroduce more stringent measures. So we have to be cautious.
OK，左手邊呢位，最後排。
The gentleman in the back.
Yeah. So I'm from SCMP, and today Finance Minister was confirmed with COVID-19 during his trip to Middle East. So I would like to ask would the Finance Minister be able to return to Hong Kong? And in such situations, can a positive patient land Hong Kong by flying with private flight? And will there be any special arrangement for him if he does not recover from COVID-19 in Middle East? Thank you.
Okay. It is not appropriate for me to comment individual case, but in general principle, our policy direction for anti-COVID, anti-epidemic or endemic strategy will be all import person, or actually people coming back to Hong Kong or going to Hong Kong have to have a RAT, a rapid antigen test negative before they can actually get onto the flight. So when they arrived at Hong Kong, they need to do PCR test on day 0, day 2, day 4, and day 6. It applies to all individuals when they actually come back to Hong Kong or come to Hong Kong visit us. So I would say this is actually the policy. Okay, 下一個題目。
Next, the lady in the second row.
From RTHK. So you mentioned that guests at functions can actually take off the mask when they take photos on stage. Could you explain the rationale for this adjustment in measure? And because you said the mask order would be, you expect it to persist for some time, would you say the two policies are a little bit contradictory? And could you explain the rationale for the mask order to persist? Thank you.
Okay. For all the on the social distancing, the considerations based on 3 principles. The first one, whether the risk is high or not. If the risk is high, whether it will collapse our medical system, make it into a breaking point. The second consideration will be the effect or impact on our economic environment as well as the well-being of our citizens. The third consideration will be the consistency of policy, different policies. For taking off the mask on stage, for some business schedule or on those premises that I just mentioned, we consider the risk of taking off the mask briefly without eating or drinking or just taking photos for a short period of time. The risk should be manageable. And then we do receive a lot of feedbacks from citizens to feel that letting them having a photos on stage probably can actually ease their worries and make their well-being much better. So this is the consideration. The risk is manageable, and then we'll think it will not impact so much on our healthcare system with a short lifting off the mask without a high-risk activities like drinking or eating.
下一個提問，右手邊第二行第二位。
I'm from Mingpao. I would like to ask you about the exemption certificates. There are 7 doctors who have issued exemption certificates, and how many of them are still valid? And holders of the exemption certificates, do you have a number on how many of them are holding these certificates? And if you do not have the relevant statistics, how do you judge that they should not be holding these exemption certificates? And what would be the impact on the COVID situation? For 599 regulation, are there any guidelines for people arriving in Hong Kong? For example, even if travelers tested positive, they can still arrive in Hong Kong. Well, now there is the requirement for pre-flight test. If they're tested positive, how many days do they have to wait until they can actually get on board? Well, I'll first talk about the exemption certificates. Currently, at the moment, the exemption certificates issued by the 7 doctors, among which that are still valid are about 19,000. 11% of the holders of these certificates have already received the first dose of vaccination. Also, around 800 citizens have already obtained a new valid certificate after the 27th of September. As for any exemptions allowed for regarding inbound quarantine measures, our original intention is to effectively control the COVID situation to minimize the infection risk and also minimize the number of imported cases. Under such principle, we require inbound travelers to have negative test result before they get onto the plane. That is the basic requirement. The gentleman on the right, I'm from AM730. For the relaxation of social distancing measures, are bars included as one of the premises? Is there a possibility to relax the number of persons per table at those premises? Can you also elaborate on the relaxation on social distancing measures in barbecue places? Can they take off the masks when they are doing the barbecue? And also regarding 599L, Dr. Lee mentioned that if the situation is stable, then there can be relaxation. What do you mean by stable situation? Can there be transitional certificate for holders of those invalid exemption certificates? Regarding relaxation of social distancing measures of eating premises, bars are included. And there is relaxation in terms of the operation hours. As for the wearing of masks when in barbecue places, for barbecue places, there will be relaxation of measures, but Other social distancing measures are still in place, including the social gathering ban of 12 people, and also other relevant legislations will still be in force. Well, eating without your mask on in outdoor area is a high-risk activity, of course. But 12 persons are allowed per table in restaurants, so it is believed that conducting barbecue activities outdoor without your mask on should not be that high. As for transitional certificates, by the 30th of November, you have to have received 3 doses of vaccination to have a valid vaccine pass. Some people may not be able to get vaccinated before the 30th of November. For example, I have already received 2 doses of vaccine, but I have to undergo surgery. So the doctor issued an exemption certificate to me, and I won't be able to get 3 doses before the 30th of November. Well, after the surgery, if the doctor says that I'm suitable to get vaccinated, then might be after the 30th of November. Thus, the Secretary for Health has the power to issue transitional certificates. We're still considering that. But at least while we're considering amending the legislation, we're thinking of empowering the Secretary for Health to be able to do that. As to when we'll be able to further relax the social distancing measures, we have to consider whether there is a continuous increase in the number of infection cases and the number of serious cases that would collapse or overload our healthcare system. This is our priority consideration. As to other considerations, we have to consider whether it will affect our economic environment after we've relaxed the measures. And also we have to consider consistency of all social distancing measures. These are all within our considerations. We'll take the last 2 questions. Hi, I'm from Now TV. I would like to ask about the relaxation of social distancing measures in bars. You mentioned that the relaxation of operation hours apply to bars, but previously in 599F does not cover bars. So how would you relax the number of persons restricted in bars? We have only relaxed the business hours of bars this time. The number of persons per table remains unchanged. So this time we're only extending the business hours of bars. We'll take the last question, the one in black. Good afternoon. I would like to ask about the exemption certificates and transitional certificates. For the exemption certificates issued by the 7 doctors, they may become invalid by early December. So people holding these certificates will only have had received the first dose. Would there be a relatively long period of time where these people would not be allowed to enter the scheduled premises? Also, it was mentioned in your press release that the vaccine pass scheme will be valid until June. So will you make a decision on when the vaccine pass scheme will continue to be enforced? Also, you mentioned that there will be certain risk if you implement the 0+0 arrangement. But as we all know, it seems that there will continuously emergence of mutant strains. So for the entire winter, is it the case that we won't be able to see the implementation of 0+0 arrangement? Do you insist in remaining the 0+3 arrangement?
First, on the transitional certificate. So the gentleman mentioned special cases involving the 7 doctors. So we will have to consider further before we have the details. So I can't tell you how are we going to cater for this group of persons. And as for the period for the vaccine pass to last, now according to the regulation, it is until June, but that is not necessarily the deadline. It depends on the situation. As for 0+0 quarantine arrangement, I do not have a crystal ball to tell you when we can implement 0+0 quarantine arrangement. I think we have to closely monitor the development of the epidemic in Hong Kong. Actually, not just the situation in Hong Kong, but the global situation. When it comes to 0+0, we're talking about the possibility of imported cases. How much can we cope? Now, if the number of cases is minor without affecting our healthcare system, then we're in a better position to relax this arrangement. We have to be very cautious. So let's all work hard. Let's see how we can build a stronger immunity defense. In fact, all over the world, the only way to safeguard the community is vaccination, so that we can build up a strong immunity defense, so that when we have stronger immunity, and then we're able to cope with more. The vaccination rates among all age groups have not yet reached a stage where we can feel comfortable. I mentioned some serious cases involving children. We feel sorry about them, and we understand that these cases will only add to the burden of our healthcare system. Children or patients that, other than COVID patients who require pediatrics ICU care, will also be affected. So we have to monitor the situation. That's why we have weekly briefings, because we would like to update you on the latest situation of COVID-19, so that we can relax all our restrictions very soon. Thank you. Thank you very much for your attendance.